Hi, this is Kristen, and I'm going to cover section 4.6 in the Open Educational Resource online text, which is about tissue healing and aging. And some of the things that are pretty important to remember are the cardinal signs of inflammation. In other words, the most important signs of inflammation. We're also going to talk a little bit about how the body responds to an injury to the tissues, how the body repairs the injured tissue, and then we'll talk a little bit about something that's inevitable for all of us, the impact of aging on tissue, and how cancer affects tissue. So to start off, you can think of tissue healing as basically occurring in three major phases. Tissue injury is the first, then severed blood vessels bleed, and then inflammation occurs, and then basically that leads to tissue injury and repair. So during wound repair, collagen fibers are laid down randomly by fibroblasts that move in to repair the area. Collagen fibers are basically a protein fiber that are laid down by connective tissue cells called fibroblasts, which create more tissue. So, if you look at this picture, basically, this picture shows the injury occurring here, where there's been a break in the epidermis of the skin, and this leads to clotting. It's basically blood clotting is caused by clotting proteins and plasma proteins in the blood, and a scab is formed. Inflammatory chemicals are released from the injury, which you can see right here. And white blood cells seep into the injured area, which you can see right here. The epithelial cells that have been damaged start to multiply and fill in over what is called granulation tissue here. The granulation tissue that's formed is basically restoring the blood supply to the injured tissue. And the restored epithelium, which you can see here, starts to thicken and mature and contract. And then there's going to be this underlying area of granulation tissue that becomes scar tissue. So if there's tissue injury and the blood vessels are bleeding, we're definitely going to have inflammation. And the cardinal or the major clinical signs of inflammation are going to be redness on the skin, for example, swelling, so the tissue enlarges, pain, it'll be painful, that's perceived in the brain, it'll feel warm, and sometimes there'll be a loss of function, but not always. That really depends on the extent of the inflammation, possible loss of function. So inflammation is the standard response of the body to injury, and it initiates repair and regeneration of damaged tissue. So acute inflammation is a way that our body heals damaged tissue, but chronic inflammation leads to disease conditions, and it's considered to be a homeostatic imbalance or a disease. And one example of chronic inflammation would be like rheumatoid arthritis, and that's a homeostatic imbalance or disease. It's chronic inflammation. Itis, the suffix itis, means inflammation of a specific organ. An example might be bursitis. Now, when we study joints, we'll talk about bursa. Bursa are little sacs of synovial fluid that pad the joints, and if those become inflamed, they can become painful, and it's known as bursitis. Tendinitis, a tendon is what connects a muscle to a bone, and if the tendons become inflamed, often from overuse of a body part, that can lead to tendinitis. Okay. Another thing that can lead to inflammation is necrosis, and necrosis is accidental cell death, and this can result from an injury. This leads to inflammation. Now, on the other hand, there's something called apoptosis that you probably learned about in cell biology. And apoptosis is programmed cell death. So it's cell death that is programmed to occur. It's normal. It's a normal thing. And it's just when the body doesn't need a cell anymore, so it destroys it. Okay, let's talk about tissue injury and repair in a little more detail, using the skin as an example. Okay, so basically, inflammation sets the stage. That's the major first step, is inflammation. That results from bleeding in the tissue and release of inflammatory chemicals like we saw in the picture above. If you injure tissue, you will inevitably damage some cells, and those cells will release inflammatory chemicals that lead to local vasodilation. Vasodilation is when the lumen of a blood vessel expands and gets bigger. So it would lead to a larger lumen. So the damaged cells release inflammatory chemicals that lead to vasodilation, and that is going to increase blood flow through those blood vessels. And that causes discoloration of the skin. And since blood is actually 3 degrees warmer than the rest of your body, it increases the heat in the area. So you get kind of a hot, your inflamed area feels hot because there's more blood flow to the area. Also, a little chemical called histamine is released, and that also leads to vasodilation. Mast cells degranulate and release a vasodilator, and that vasodilator was the histamine that I mentioned. And the mast cells release that histamine from these little secretory vesicles. So the blood, the histamine, all lead to inflammation and vasodilation and heat. The body has a way of recruiting white blood cells to the inflamed area, and that's a good thing because white blood cells have the capability of protecting your body against foreign invaders and disease-causing agents like pathogens. Well, how do you recruit white blood cells to the inflamed area? Basically, the increased blood flow and the inflammatory chemicals like histamine attract the white blood cells. It's like they put out this little beacon that calls the white blood cells to the site of the inflammation. And that causes these blood vessels to become more leaky. They're more permeable. They're more permeable because of the histamine and the other inflammatory chemicals. So the endothelium, or the lining of the local blood vessels, becomes leaky to fluid. And fluid in the blood vessels, which is basically blood plasma, can leak out of these blood vessels into the tissue space, known as the interstitial space. That's what leads to edema. So in a tissue, you could have a blood vessel, and I'll make that purple. You could have a blood vessel, and you could have surrounding cells But fluid or blood is made up of both cells and plasma, which is the liquid part of the blood. And so some of that fluid in the blood will seep through the blood vessel and fill up the tissue space. That space around the cells, that's called the interstitial space. And as you get more fluid into the interstitial space, it causes swelling, and that swelling is called edema. Swelling stimulates receptors that are sensitive to mechanical forces. Therefore, they're known as mechanoreceptors. Anything that pushes on them is going to stimulate them, and that basically causes those mechanoreceptors to send a nerve impulse to the brain, and in the brain we perceive that swelling as pain. And so how do we treat this edema and swelling and local heat that we're feeling from this inflammation due to our injury? Well, typically we take over-the-counter non-steroidal anti-inflammatories, also known as Nsaids. And they reduce the pain because they basically inhibit the synthesis of little prostaglandins, which are local chemical messengers made up of lipids. And sometimes when people are feeling the effects of an injury or even an allergic reaction, they'll take an antihistamine. Antihistamines are medications that block the histamine response. That's a part of this inflammatory response. And they're really helpful for an allergic reaction because they block the histamine receptors, and that contains the injury. So, once the injury is contained, then we can go ahead and move on to the tissue repair phase. So the body begins repair by removing toxins and waste products. And then blood clotting, also known as coagulation, can occur. And the blood clotting reduces blood loss from these damaged blood vessels and forms this network of fibrin proteins that trap blood vessels and bind the edges of a wound together. So the blood has a fibrin protein in it that remains dissolved in the plasma most of the time until we have an injury to the tissue. Then that fibrin comes out of solution and basically helps to form a blood clot. A scab forms when the clot dries, and that reduces the risk of infection. Dead leukocytes, or dead white blood cells, can form in the wound, and that can form pus. And pus is basically a bunch of dead white blood cells. So organization, after we basically remove the toxins and waste and we blood clot and we form a scab, then the body can organize itself to restore the blood supply. So organization is basically when the blood clot is replaced by what is known as granulation tissue. And granulation tissue is this very delicate pink tissue that lays down capillary beds, which are microscopic blood vessels. Fibroblasts replace the collagen and the extracellular material, which helps bridge the gap or the wound, and it forms this granulation tissue and leads to what is known as angiogenesis. Or you can think of angiogenesis as blood vessel formation. So, as healing progresses, fibroblasts, which is a cell and connective tissue that produces collagen, protein fibers, and other fibers, fibroblasts basically make more connective tissue. So as healing progresses, fibroblasts from the surrounding connective tissues replace the collagen and extracellular material lost by the injury. Granulation tissue is formed and angiogenesis, or the growth of new blood vessels, occurs. The granulation tissue ultimately becomes scar tissue. Angiogenesis, or the growth of new blood vessels, results in vascularization of the new tissue, known as granulation tissue. Now, macrophages, which are a really large phagocytic cell that engulf dead, dying cells and debris. So phagocytosis is when a cell engulfs debris or a dead, dying cell and destroys it. So macrophages do that. And then surface epithelial cells multiply and migrate over the granulation tissue. The clot retracts, pulling the edges of the wound together, and it slowly dissolves as the tissue is repaired. A primary union is the healing of a wound where the edges are close together. When there is a gaping wound, it takes longer to refill the area with cells and collagen. The process called the secondary union occurs as the edges of the wound are pulled together by what is called wound contraction. So, when a wound is more than 1/4 of an inch deep, sutures or stitches are recommended to promote a primary union and void the formation of this disfiguring scar. The fibrosed area contracts and the epithelium thickens. Regeneration and fibrosis causes permanent repair. Newly regenerated epithelium forms this underlying scar. When a large amount of granulation tissue forms and capillaries disappear, a pale scar is often visible in the healed area, and the scar is covered by newly regenerated epithelium. Regeneration is basically the addition of new cells of the same type as the ones that were injured. So to summarize, you can basically summarize everything I said by studying this picture, which basically shows the steps in a less detailed way. And I think it's fine just to have a basic understanding of this and not necessarily know every single detail. That we have an injury, it leads to bleeding, which leads to inflammatory chemicals being released, which calls in white blood cells, which increases, then we have vasodilation, it increases the heat and the redness. Then we have the laying down of granulation tissue and revascularization. And then ultimately, the epithelium is restored, and there's usually some underlying area of scar tissue. I'm going to go ahead and pause it here for a moment.